Bonjour à
Hello, everybody. I'm very happy to find you here again on this Sunday morning. We're going to be talking about public services of the future in this session. And we've got an exceptional panel of speakers. So just to introduce the panel, my name is Yann ALGAN. I'm Professor of Economy at HEC School. And this question of future public services is so very important in this context when citizens are mistrusting our institutions. Reinventing tomorrow's public services seems a key issue so that we can re-establish the trust of citizens in the government, but also their well-being. So there are lots of big questions that need to be asked. What is the role of digital technologies to improve the efficiency of public services in a context where there are still digital divides? What about local aspects? The Yellow Vest movement talked about how important it was to have a local focus. How can we meet that demand? But more fundamentally, it seems that citizens want a co-design of public services with all stakeholders, local authorities, the state, companies, associations. And so to be able to envisage this new future for public services, it was important to have an exceptional panel of speakers with a multidisciplinary approach. And that's why this morning we're lucky to have Estelle BRACHLIANOFF, who's the director of the group Veolia, Jean-Marc BORELLO, who is president of the board of directors of the group SOS. We have the first vice president and member of parliament for the National Assembly. We have the economist Jean TAWILE.
la députée Aurélie TROUVÉ qui pourra se joindre.
I'm sorry, but there is... Oh, it stopped, it stopped. There's a microphone open somewhere, sorry.
Alors, je serai le bad guy. On a juste 6 minutes de présentation au départ, mais après...
We've got 6 minutes to begin with, and then we will have a longer time with the general public. Thank you.
Utiliser un mot que vous avez donné dans votre introduction.
I'm going to start with a word that you used in your introduction, a local focus. Public services for the future need to be imagined with local areas. So before we even talk about digital technologies, innovation and everything, that's the way things should start, with this local focus. It's true that Veolia is quite specific from this point of view. For 200 years now, we've been working with local authorities. We've been delivering public services, essential services, water, energy, for waste management in all kinds of different cities and towns and the countryside in France. And quality has improved over the course of the years. We've been able to invent new health, environmental standards in various areas. So we see the glass half full. So we have a good quality public service today. Now, the fact that we work with all these local areas, 55,000 employees in France, millions of users who use our services, and we have direct contact with them. We have them on the phone. They all say the same thing. They all say that they need a local service that has been reinvented with them, and that's what you mentioned. It has to be simple, it has to be understandable, it has to be readable, and it has to be inclusive in the sense that it has to take into account everybody. And you've got to invent this with all of the stakeholders in the area, so the local authorities, the state, but also associations, Chamber of Commerce and Industry, for example. So we've got to focus on solidarity so that people can pay their water bills. So it's all very well having a financial mechanism in place, but people need to know about that. So it's important to draw the links between what is available and helping people to access that. We've got to work with associations and chambers of commerce. So we've got to reinvent public services from the bottom up. This means we've got to give back to local areas. When you're recycling a bottle of water, instead of putting it in a bin, this means inventing new jobs. So by working on digital technologies, by working on recycling, that creates jobs. So all local areas in France are concerned by this at all hierarchical levels. So that's the first notion. The second notion, if we think about reinventing future public services, we think about technology, obviously. We think about digital technology. We think about innovation. Already many things have been done, as I've said. If we look at the public services that we have today compared with 20, 30 years ago, the health standards relating to water, for example, have greatly improved. And we followed this. Environmental standards are obviously important. When it comes to digital technologies, well, these are important for users, but also for purchasing power. When you use sensors in order to make energy savings, for example, so that you can recycle more, this is good for the planet, but it's also good for people's purses. So that's why it's important to use these technologies and to have innovation. Let me just say a few words about innovation, supporting the planet and the environment. A big company like Veolia has a footprint. It has a portfolio of technologies. It is able to innovate. We have a critical size so that we can work on the local areas in France and invent things so that we can find the new borders. We can improve the service efficiency. We can have less loss in water networks, which means that the people's bills are not going up. But we're also able to invent tomorrow's solutions. There's a lot of water pressure in France. There are more and more restrictions being announced in terms of water use. One solution is to reuse wastewater. And it's thanks to Veolia technologies, thanks to the know-how built up in Spain and Chile, because they've been experiencing this problem for a lot longer, that we are able to work in the Vendée with local authorities in the Sable d'Olonne area to create a first in France and Europe, a first example of use of wastewater. So we've got and we're able to use this to provide drinking water. So it's about providing users with solutions and helping people with their purchasing power. So that's one of the keys. So it's about reinventing the public services of the future. The future is now, so let's roll out all of these services in even more areas across France.
Merci beaucoup pour.
Thank you very much. I'm now going to hand over to Jean-Marc BORELLO. Yes, thank you. Thank you to everybody. So public services are sold by civil servants and private companies, and they're sold by a sector that's been forgotten, and that is that of the social and solidarity economy. That sector is entirely devoted to general public. So I represent SOS, the group SOS. So we manage hospitals, not clinics, private, as long as they are not private clinics. And we've been able to improve their resuscitation operations. We work with nursing homes. It's the first non-profit-making organization to be able to do that. It's not the same if you're a nursing home and you're private, and if you're a nursing home with a non-profit making organization behind you. So we have a whole series of mechanisms. We work on environmental transition. We've got over 1,000 employees across France working in this field, working with those who want to find out more about these jobs. It's all about international solidarity because we're in about 40 or so countries. We're managing 100 or so schools for girls in Afghanistan. Some, unfortunately, have been closed, but we do intend to open them up again. And then there's the situation in Afghanistan. We've had to close them so that we protect our employees. We also host over 3,500 Ukrainian refugees. We were able to host them, to accommodate them, to find solutions for them, either to help them get back to their countries or to help them go elsewhere or to insert them into the French landscape. So we are the first French organization to help young people with social problems or young people being protected. So we provide public services and services that are in the general interest of the public. So our innovations are not necessarily technological, they're often social. How do we focus on how to face the different problems? We have different objectives that we're following at the same time. In national interest markets in Lille, Marseille, Perpignan, we have teams of young people who use unsold fruit and vegetables. They pack them, they process them, and this allows them to work with 800 groceries. So we work with 100 or so associations so that those in difficulty feeding themselves, they can have fresh fruit and vegetables because food help is often based on tins or dry food. So in our case, we can provide fresh fruit and vegetables. So that's a healthier diet. So clearly, we're preventing hundreds of tons of food waste from big wholesale markets. We're allowing young people to find a job, to become specialists. So they can be forklift truck drivers, for example. And we're also allowing our nationals who are in the greatest difficulty to have access to fruit and vegetables of top quality. So this is typically the kind of area where innovation is not technological, but it is social. It's focused on an objective that meets a general interest, and sometimes there are economic innovations. The first economic innovation of an organization like ours is that we don't have any shareholders. That might make you laugh. But so when we created our organization, people explained to me that, we wouldn't be able to last. But we have 25,000 employees today. It's 1.3 million in turnover, and we're doubling in size every 5 years. So obviously you can create economic activity without having shareholders, without having capital. But, economic innovation can go further than that. I mentioned nursing homes, and I've stayed light in the matter. But from an economic point of view, a few years ago, we said to ourselves, in nursing homes, there's something that's not used that exists in social housing, and that is a solidarity-based rent. Now, in this sector, the richest go to lucrative nursing homes. They might not be better treated, there's no guarantee of that, but the poorest stay in the public service. But you were talking about organizations that have difficulties investing, getting up to scratch in terms of standards. When you don't have the right critical size, it's quite difficult to do this. And so we've decided that in our nursing home, there's going to be a solidarity-based rent. So we'll have those who have nothing, who are covered by public support, so those without much income. And then we will have those who have limited income, who pay a minimum amount. So they pay a price that is much lower than others who benefit from nursing homes. And then there are others who have a little bit more and who, for the same service, they pay a rent that goes from 5 to 10 euros a day, which is not that high. But this means that we can have quality nursing homes, we can pay managers, supervisors, so that we can face things like a COVID pandemic in a better way than our friends who work in the private sector. So the consequences for us were not as terrible as in other nursing homes, because we're used to working in the way we work. So we work together because there are many subjects where we can work together, and we're bringing together our strengths. We are working very closely to local authorities. During COVID, the county council was very important. So it's important to continue to innovate and to be radical in the way we operate economically. It's important to work with academics. Yann ALGAN has been helping us with a number of our operations, and I'll finish with that. And then after the Yellow Vest movement, so it was villages were closed, and in November we decided that we would launch an operation based on providing help to difficult areas. So we reopened cafes where there were no longer cafes. So this required a law which will have to be renewed, Member of Parliament. It's a law that consisted in making available free of charge licenses so that people could open cafes. So whatever the MP group we have, I hope that we will be able to do something about this law. We opened the first cafe just before the first lockdown, so that made it difficult. And then after the lockdown, we started again, and we've opened 100 cafes, and we've got 1,200 villages that have applied for the license. So it's the mayors who apply, and SOS is in charge of the system that takes over places, transforms them, recruits managers. And of course, these are cafes, grocery stores. We have an agreement with Val, and this is so that we've got post office outlets. We can also work digitally. So it's based on entrepreneurship. It's not subsidized. My finance director has still not forgiven me for this, by the way. And globally, it's an economic solution that is going to balance out. And objectively, it allows villages to have a new lease of life. When I saw the population in the village coming on the day we inaugurated the cafe with tears in their eyes, because that there was one person who'd been trying to open their bistro for 7 years, this was a very warming experience. Thank you. Thank you very much, Jean-Marc. So that's a great transition. So we've seen the point of view of a very emblematic group, Veolia. We've heard about the social and solidarity economy, but what about politics? We're lucky enough to have with us the Vice President of the National Assembly, Member of Parliament. Over to you. Thank you. Hello, everybody. So we'll go and have a coffee in one of your cafes. That would be great. So perhaps 5 points about the question of imagining the public services of the future. First of all, I'm delighted that the Cercle des Économistes is asking this question, because often this is what we debate in the Parliament. And they say, well, we need less of this, less of that. And I don't agree with that. When we look at the last survey that came out a little while ago, most people want to say that public services exist, but people say that they need to work better. So we agree. It's important to have sustainable public services. The second point is that there have to be priorities. When there are no priorities, things tend to collapse, and the compasses are not very clear. There are 3 that are important for the state: education, health and the elderly, and safety and justice. So these are 3 pillars And this is where we need to invest most, which is not the case today, notably when it comes to education. If we want our society to have a future, to invent a future, we need to have much more support for education. I have a program in the Tarn-et-Garonne. We are carrying out a survey on all children in their last year of school who don't have enough career guidance. And we put them in front of a screen, and we realize that many of them don't have any support, don't have any advice. They're just left to get on with it. And that's not acceptable for a country like ours. It's not acceptable to let young children deal with their future themselves. Now, I've just come out of the legislative elections, and this is where, when it comes to health, where I felt a kind of anguish, anxiety. When you've got emergency wards closing, when you don't have any GPs, now, and I'm talking about private practices and not just GPs working in the public sector, it's important for everybody to have access to a doctor. Otherwise, you know, the older you get, you experience anxiety, and that's something that is reflected when people go to vote. So a state like ours cannot let people feel this anxiety. It's important to have emergency wards open. If you don't know whether they will be open, that creates anxiety. So you've got 10% of the population, 25,000, without access to a GP. And that figure is going up. And that's an absolute priority. And of course, so is safety. So the third point I want to bring up is the fact that we've also got to have higher skilled public services. So for very simple questions, the state has delegated urban planning. Now, urban planning is quite complicated. The state needs to be investing resources. There are associations of municipalities. You've got risk-taking. That is important, and a state that's not taking risks means that it is not as powerful. If we talk about day-to-day life, if we talk about ID cards, there's the question of the postal service. All of those services need to remain open, and we need to focus on agility. It mustn't just be about, you know, the post office will be open from this time to that time. What you're doing at SOS by associating post offices, post office outlets. That's great to have that kind of agility, but I don't know whether we're ready to do that. Agility means that you have a little bit of freedom, and that's not necessarily always the case in terms of the way things are coordinated. The fourth point concerns digital technologies. It's great to have digital technologies. We need to stop anonymity. When the state hides behind an application, and when you call somebody, you never speak to the same person, you lose trust in the state and public services. It generates a form of anxiety across the country, and that's why I think that the state needs to revise the way it works. There's a service that it does provide very well, and that is the tax service, because it's important to bring in money, to get money in the coffers, so you're always reminded of your taxes. And there you have somebody answering the phone. If I take another case, the agricultural social insurance organization, it no longer sends out statements. So people in the agriculture industry don't know how much they are going to have when they retire. And then the last point where I would like to say something concerns the ability of being able to manage crises. This is something we've seen. We're not good at managing crises, at least not good enough. In the United States, you've got an agency, La Barda, that can bring out the funds necessary when action is required. So this crisis management in private companies, there are different general managers here today with us on the stage. Well, you will see that you've got the right number of masks. It's absolutely essential to be in crisis management mode. And then there's the energy question. So 5 pillars that are essential if we want to build these public services of the future. Thank you. Thank you, Madam. So I'm now going to hand over to Jean TAWILE, who's going to shed light on the situation from the point of view of the economy and the Lebanese economy. Yes, hello, everybody. So the irony and the biggest intellectual challenge was to ask a Lebanese person to come and talk about future public services. You know, in the Lebanon, well, for those who don't know it, there is no more electricity. There never really was any electricity, but really there's none at all now. Access to water, well, it's rationed. It's very difficult to have access to water. Social security, there's no point even mentioning it. They don't know what it is. Telecommunications, infrastructures, everything is very diminished. So you will understand how difficult it is for me to do this. Having said that, there is something that helps a lot. I could say to you what you shouldn't be doing. I can definitely tell you what you shouldn't be doing, because what was done over there was do not repeat it here, or at least don't do it in the future. So I'm going to share with you something, so a number of points, well, 3 main points, in fact, that I'm going to share with you. I might not agree with the lady sitting next to me, the Member of Parliament, but that's the beauty of democracy, the beauty of being able to take part in a debate. Now, my first point, then, when we talk about the state is it's people, human beings just like everywhere else. Now, the crisis in the Lebanon, it's true that it has been one of the biggest crises over the past 150 years, if we talk about things at world level. But it's also a crisis that was voluntarily started by human beings. And this is what the UN and the UN rapporteur said. It's a man-made crisis, basically. So this brings me to talk about a theory, and that is the theory of agency. I don't know if people know about agency theory. So we are the principals, and then there's the agent to whom power is delegated. So in this dilemma between the principal and the agent, there's a problem. The objectives are not always in line. And secondly, you've got asymmetry in terms of information, because the person to whom you delegate, so members of parliament, civil servants, they have access to information that is not necessarily shared with everybody. So, given that, what you have to keep in mind is the human being and everybody's responsibility, integrity, the integrity of these people, whether we're talking about us or the agents to whom we give power, to whom we delegate power. Whether we're talking about the commitment of those people, they need to have a real commitment, or something else. Above all, it is our role to be committed, and we have to be concerned about everything. We have to be committed, we have to follow, we have to ask people to be accountable, we have to have the sense of responsibility, or whether we're talking about an agent or principal, everybody has to feel that sense of accountability. And transparency is also very important. This is something that has to be shared by agents and principals. This needs to be kept in mind. You know, if there's something that's not going properly, they have to be made accountable. They're people like everybody, and they have to take on their responsibility.
The second point I'd like to make is, I don't know if you can remember, the 17 Sustainable Development Goals established by the United Nations. These goals enable public services and public organizations and businesses to have a certain coherency in the way they do politics and create policies and identify priorities. When I think of those 17 goals, given that I haven't got very much time, I'm going to just pick 3 points out for you. Goal number 16 of the United Nations Sustainable Development Goals is to have strong institutions, justice and peace. When we talk about strong institutions, the Madam MP sitting next to me, I do not think that, or rather, I think that the role of the state is to have, in order to have strong institutions, means that you have a state which makes regulations, a strong state, a state which makes things possible, but not necessarily the actor. The state cannot be the actor. The state can regulate, create rules and regulations. I know that because we've been through that in the Lebanon. We see how they can be exploited. We see how they've done everything they can to keep a weak state so that the state can play a big role in political, economical and social aspects of life, to the point where we have achieved what we've achieved today. There's no independence in the judiciary system. There are no strong institutions. There's no public services. So the state has to get back to a definition. What is the role of the state? The state cannot be a player, but it can regulate and it can facilitate things which are going on. And that brings me on to my second point, or goal number 17 of the United Nations SDGs, which is partnership. Partnership between public services and private services, public-private partnerships. This is a really important point, and it works. I know there are many people who are wondering about this, but yes, it works. And the biggest proof of this is that public-private partnerships, well, the Lebanon doesn't want them. The fact that they are not wanted in Lebanon, I can guarantee that means that they work really well. Yep. Public-private partnerships will mean that we can respect what I was referring to in my first point. Third point, I've got to hurry along here. Let's talk about water and access to water. Given that we have Veolia, and yesterday there was a session which was really interesting on about territorialization of government and governance, and one speaker was saying that very sadly, the last conference that was on water was in 1977, and the next one is going to be in 2023, and that means that we'll be able to have supranational governance which will then filter down, trickle down into the territory. So that's really important. The final point, my last point, is really important. Madam MP, yes, the state does collect taxes. It does that role very, very well, but that's just not enough. So the state works to collect taxes, but there's always a deficit. And today, if we are going through experiencing this galloping inflation, and I think the situation can only get worse, I think that's because of budgetary policy and monetary policy, but particularly budgetary policy. As President Trichet said on the first day of this event, we have to keep that in head, because you can solve a problem in the short term, but in so doing, you can awaken a monster for the future. Thank you very much for listening to me. Thank you very much, Jean. We're now going to hand the floor to Aurélie Trouvé, who is joining us remotely. Hello, everybody. I do apologize for not being with you in the flesh. However, I was a researcher and a teacher in economics until very, very recently, and very familiar with public services. My point of view is following on from what Madame Rabault has said about the very concrete situation of public services today. I'm going to talk to you about salaries, recruitment, and management through needs. First of all, first observation, basic public services, those which are and I was listening to Elisabeth Borne, the French Prime Minister, yesterday talking about equal opportunities. Today we have a public services which is not permitting equal opportunities. And I think that's true in the field of education. I'm an MP for the Saint-Denis area in Greater Paris. My children are at the schools, state schools. And they've lost about a year's school teaching because they want enough teachers in the school. We need 200,000 new teachers. There aren't enough teachers in France, so that means for the coming school year, we're not going to have enough staff. And that's not to even mention the other types of members of staff. Those who take care of extracurricular activities, for example. There is a whole gap in the network. I'd like to say a few words about public hospitals also. Public hospitals, again, are in a dire situation. We have one department in each hospital, which is more or less closed. Public hospitals have been suffering, particularly since last October. This means that these are essential rights that cannot be met today. They cannot be provided by public services here in France. So how can we rise to all of these challenges? How can we provide these public services, such as providing healthcare? And would like to talk also about recruitment in terms of needs in France. A nurse starts at 1,500 euros net. It's twice that amount in Germany. In France, a teacher, 1,600 per month. And so let's not be surprised that there are fewer and fewer people who want to become teachers. Similarly, in terms of the number of recruitments, all of the different healthcare organizations say that we need 100,000 carers. The teaching organizations say we need 70 million more teachers in state education. So there are huge needs there. And with my political group, the NUPES, we think we need 1 million extra people who need to be recruited for public services. And I would also like to say that it's essential not to increase expenditure, special types of public expenditure. It would cost 75 billion euros on top of what we already spend if we were to recruit those people, just to satisfy essential needs. But I would also like to point out that this has all been calculated. There are dozens of economists who have worked on this and supported the NUPES economic program because it means increasing contributions, etc., increasing taxes to increase public revenue so that the state can provide all of these services. And I would just like to wrap up with this question of management and the management function, which is applied in public hospitals, but it could be applied increasingly to other areas. We have a pricing system in hospitals whereby profitability is given star status. So one chooses care acts in function of profitability rather than in function of the patient's needs. And I'll just wrap up by saying something about the yellow vests. I don't have the same perception of the yellow vests. For me, the yellow vests were occupying roundabouts. They didn't get together simply to have a drink at the roundabout. They got together because they were really angry. They were angry about all of the social inequalities which are thriving. And public services are the wealth of those who have no wealth. And there really is a true need to build back public services, such as education and healthcare. They are in a dire situation today, and the staff who work in those sectors say that, as do the users of those sectors. Thank you very much for listening. Thank you very much, Aurélie TROUVÉ. We've got 5 minutes now to open up the debate. We can open up questions and answers. Would the panelists like to say something to begin with? Yes, I would like to come back to my neighbor from the Lebanon. The question which we have to address today is imagining the public services of the future. We're not talking about defining the state's role. Yes, the state has a regulatory role. It also has a role to provide public services. It has several hats to wear. So we can talk about all of the things that the state should do in terms of defense. No, I didn't talk about that. I'm talking simply about public services here. And out of those three levers, education, healthcare, and security, the state has to shoulder its responsibilities, but with the necessary agility, of course, and some risk-taking, with dialogue that is much more inclusive of all citizens. But the response I have is pertaining to public services, not the role of the state, which is a broader question. Thank you very much. Are there any questions from the floor? Oh, there's a hand being raised. Please use the microphone. Thank you very much. Hello, everybody. I'm not asking you to define the role of the state. I'm asking you to go further than that. There are a lot of youngsters here at the economic conference that we're having here. I'm a student nurse, and I should graduate in 6 months, but I'm stopping my studies because I no longer believe in those studies. Because we've heard what you said, but you have to go further. We need actions now. We need solutions. We need reform. We need something which is going even further than just words. We cannot just be happy with all of these observations. I'm not asking precisely what the state is going to do, but how it's going to grasp these problems in healthcare and education. Thank you very much. Who would like to answer that question? It's a bit about the role of the state, but Veolia also has some concrete suggestions, and also the solidarity business here. I think, sadly, things are not that simple as simply adding to a system which does not work, adding more people so that the system will work. Our group, SOS, we are recruiting nurses and carers in our hospitals. We have created some training schools for our nursing staff because there is a lack of personnel, and that's due to the fact that there are no candidates. So we have 250 jobs available at SOS. I think, on the other hand, however, during nursing studies, last week I was working with the union to try and identify some measures which would enhance the training. After you've got a healthcare worker who's worked in a hospital for 5 or 6 years, for example, and if you can help them to go on to nursing studies, 85 of those healthcare workers will see those studies through and will become nurses and will remain nurses because they know that profession. It's not a simple profession, to get back to what Valerie was saying a minute ago. Choosing the job of being a nurse just from a website before you've ever been in a hospital is very, very difficult. However, we've got these healthcare workers who've been in hospitals for 5 years already. They love hospitals. They want to become nurses. They know what they're getting into, and enabling them to carry out those studies that will enable them to be nurses in practice, or even doctors, because nurses can also write prescriptions. Well, that's a good way of going about it. But Muriel Montgomery wrote a wonderful report on nursing homes and training. Nurses, just like teachers, for example, for them, nobody is answering these job vacancies. So there is a question of the salary. Remuneration is a key issue, of course. Salaries have gone up more over the past 3 years than they had during the 20 previous years. So we haven't done everything that needs to be done, but we're on the right track. But boiling everything down to salary is like dancing around the fire, hoping to make the rain fall down. But we manage nursing homes, and we know that we have to do a lot more for the employees, including training. We have to enable them to climb the career ladder, and we have to offer these jobs to people who really want to do them. And that's not always the case when you're just picking your job from a network, from a website, when you're picking the job of a nurse, for example. Thank you very much, Jean-Marc. I'm going to hand the floor now to different players, because this question really does address several dimensions. You've got the salaried employment. What do the public want? Giving meaning to work. Would you like to say something? Yes, of course, that brings many things to mind. It's all about human beings, of course. And then, of course, we need systems that are well organized. But let's give people a chance. Let's give the territories, the regions, employees, civil servants a chance, an opportunity, so that they can come up with solutions to these problems. I think this is really key. We can talk about empowerment here. There's nothing more exasperating when you call up a call center. The person who picks up the phone would like to help, but they cannot even, they've got no scope, no room for maneuver, so they have to send you on to a second or a third or a fourth type of procedure. I think we have to enable those people who pick up the phone in the call centers to say, yes, I can solve this problem for you. I will find a solution. So simplicity is a key word. Let's give human beings back the power. That's what we're trying to do at Veolia in our managerial organization. We want to enable people to act locally in a broader framework, of course, to enhance our ability to innovate and scale things up. And that really is so important. And I see a lot of young salaried employees who are saying that they want to make a difference at their level. I want to know what the impact is that I can make within a group, but what is the impact that I can make? And that really is something we should look closer at. Thank you very much. Madam MP, would you like to come back on that? I don't know what studies you're giving up, but I really would encourage you to continue. She was training to be a nurse. Well, perhaps we can have a little word privately after this round table. Okay, I hear what you're saying. I know that the school leavers are not turning towards nursing because there have been competitions to get into the courses, etc. Anyway, you do have opportunities, whether you work in in surgery or. I don't know what the problem was with you. We need to talk about this. You and I will meet after this meeting to hear what the problem was. But I don't know why the system has become jammed. Nobody can come up with an answer, and you're just shuttled from one department to the next. And it's absolutely heartbreaking. When you're an MP, you've got cycles. You've got people to come see you about one problem or another problem. At the moment, we feel that we're going to have to knock down these silos in our departments because people aren't talking to one another. I think that's the impact of COVID when we're all locked away at home. I don't know what the reason is, but that's the feeling I have. And the system has jammed, and it's absolutely terrible. When you're an MP, you can call the head of the hospital, but you're not necessarily going to do that because, well, the hospital head doesn't call us. So. And it's true. We really need to find a new lease of life. It's all well and good saying what we need to do is. However, in all sincerity, in the question of health carers and nurses, there are so many opportunities. Do not throw in the towel, whether you're a freelancer healthcare giver or if you're working in the social arena. There are many opportunities. And you will have autonomy, and you will instantly see the fruit of all of the hard work that you've put into your studies. So we do have 5 more minutes for a second question. I can see a couple of hands being raised there. I've got a question. The title of the session was Dreaming Up the Public Services of the Future. However, I think the nitty-gritty of the subject is not losing the public services that we have today or have had in the past and bring back the quality that we may have experienced in the past. But I think we're not really dreaming up any new services. We're not talking about food security. We're not talking about universal revenue. We're talking about what exists now. I'm in the youngsters group here at the event, and I think we want to hang on to what we've already got. And if we lose all of that, we'll have poor healthcare and poor education. But we don't see a future whereby we're going to have something better. So it's not a question, I agree, but I think it could trigger some responses from your panel members. Do you also want to ask your question and we'll answer everything all together? Yes. I just want to help Madame BRACHLIANOFF, and I want to help the MP to unblock the situation. The key is empowerment. We have to trust other people out in the field, and we have to stop taking decisions in place of them. Thank you very much for your suggestion. Who would like to come back to these questions? I'll perhaps allow Aurélie TROUVÉ, who's with us remotely. Perhaps she'd like to chime in here. Yes, hi again. Thank you very much for handing the floor back to me. Yes, I'd like to come back to the question of trusting other people. Those workers who work, the civil servants. So why is everybody leaving public hospitals, etc.? All of the organizations we've met with agree that salaries are too low. So there has been a bit of a rise, but it's not as high as the salaries in Germany, for example. And they're way lower than what nurses earn in the private sector. So yes, it is a problem of salary today. It makes it an unappealing job. Our civil servants have lost about 10% of purchasing power because of their index points being frozen, whereby in the meantime other salaries have gone up. But yes, recruitment is a problem. We've got healthcare workers who are really suffering greatly. That's what they're saying to us, because they have less time to spend per patient. They can no longer take care of their patients properly. And yes, here again, it's very discouraging for them. They come into work in a public hospital. And so what can we imagine in the future? Something new? We've mentioned this universal revenue. I would like to say the new PES, my political party, is suggesting guaranteed autonomy for youngsters in terms of training, a sum of €2,000 that will enable them to carry out their education and do internships, and would enable nurses to discover what work is like in a hospital. They would discover the environment that they will be working in. So there are internships which introduce youngsters to the working environment. So for SOS, whose turnover is increasing as public services profitability is going down, you are in a it really is essential to get back to public services that work well, that work better. Much work remains to be done, but in my eyes, I think the best way of functioning is to meet needs. And to do that, we have to leave behind us this mindset of profitability, which is rife in hospitals. Yes, I'd like to come back to what the gentleman said about two things. I travel a lot. Veolia is an international company. We're in 40 countries. And I can tell you that in the businesses which I know, water, waste, and energy, France offers some of the best service quality in the world in terms of the ratio between service and quality when we're talking about healthcare. So we are among the top rankers there. I think we can pat ourselves on the back on this front. However, we could go further. And as I said earlier on, in our different regions, we have resources which will enable us to improve the quality of public services when we're talking about the environment. We've talked about the environment. It's a major challenge. And today, greater than the past, and in the future we'll be able to do even better than we can do today. We will find energy in biogas stations and other treatment facilities. We've got these water treatment facilities which produce electricity. So we are reinventing public services faced with these environmental challenges of being more sensible about how we use and produce our energy. So we can reinvent here in this field, and that's why I want to talk about this, because it's a question of the future. Shall we wrap up here? Jean, would you like to say a few words? Well, very, very quickly, and I will, it's in line with what I said earlier on. One of the points which I wanted to bring up was food security and malnutrition. Sadly, we don't have time to talk about it. However, this is in one of the other United Nations Sustainable Development Goals. So there are some interesting points in what could be done to reach these objectives, particularly with what we're going through at the moment with the war in the Ukraine, inflation, and the risk of malnutrition. And we've got greater food security risks too. Let's go think beyond farming. Let's think beyond subsidies. Let's think in an inclusive way. Let's have a 360-degree point of view. There are so many proposals, but we don't have time to talk about them today, sadly. Well, thank you very much, Valerie. Yeah, just to get back to the gentleman. The question that you're putting forward is about the type of model of society that we want. It goes beyond public services. That model of society is how can we give everyone an opportunity? How can they remain free, give them freedom of choice? I have been fighting over the past 5 years so that youngsters are not forced to go out to work in the evening so that they can pay for their studies. France is one of the 4 countries in the European Union. There are 4 of us, which has no support for youngsters between the age of 18 and 20. So we've been fighting to rectify that. It doesn't perhaps answer your question, but the question this morning is about public services. That's why I was focusing on healthcare, security, and education, because if these 3 levers are faulty, you can have all the models in the world, the best, the highest aspirations, but you'll never be able to pull them off. So those 3 levers have to be so very solid. And we have seen, and this takes us back to the question from the lady about the nursing schools, yes, sometimes they don't do the job, and that renders society fragile. Jean-Marc, if you'd like to say the closing words then. Well, I'm not going to get into this controversy with the MP who's sitting next to me. When the turnover of a not-for-profit organisation, a cooperative, goes up, that means that we can offer more services to those who are most impoverished. Because we help 2 million people per year. And I don't think it's the role of the state to go and open a cafe in a village. However, a not-for-profit such as SOS can do that. But to get back to the question of innovation, yes, we are at a turning point. But we have to be positive here. We have to take a positive turn by inventing new measures to get back to the young gentleman who asked that question and other questions. We didn't invent electricity by trying to enhance the candle. Let's try to be innovative. Let's think differently. Thank you very much. Thank you, really, to all of our panelists, our speakers, and thank you very much to our audience. See you soon.